28th meeting of the Humboldt County Board of Supervisors. Let's begin, if you would, by joining me in saluting the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We need to practice.
Some serious
Okay.
rhythm issues.
I think okay. So with that, Madam CAO, do we have any additions or subtractions from the agenda?
Good morning, Chair Fennell. Yes, we do. Health and Human Services Director Beck would like to pull item H2, and that will return at a later date.
Okay.
Supervisor Bohn would like to pull item C7 for discussion.
Thank you.
H2 and C7.
C7. Great. Thank you. With that, I'll entertain a motion. Supervisor Bass?
A motion that we approve the consent calendar with the modifications that were just brought forward.
Thank you.
Second.
A motion and a second. Any discussion on the consent agenda, please?
Ken Sawatsky regarding C1, I think we're on consent, and this is going to be an intelligence test as far as the Board of Supervisors moving forward with that consent item. Just so the public knows, they're going to be spending, and I don't have my glasses, something around $375,000 to preclude us from having to give back $50 million. And of course, if any of you were to vote no on that one, I would question what you're going for as far as that goes. The minutes of last time reflect a certain your policies regarding your employees, shunning and things. I don't know if intentionally lowering somebody's chair to diminish their height, that the dais would be a thing that would fall under, but you never know what's happening out there. You can't mess with people's workplaces and all those other things. I still question that having moved forward as far as that being on the minutes and having been approved unanimously. It appeared to be another retroactive thing, and I will discuss that a little bit later in the meeting. But I did want to point out, with our airport there, it's imperative that we get that thing and don't have to pay back $50 million and lose. And I don't know how we got to this point where we're even at this point now. It seems to be kind of a little bit behind the timeline or something. I think you approved it a while ago, but the money didn't actually get moved forward until today. I think it was budgeted, but that's always a question. When it comes time to deal with those things, we may be shutting down some of those smaller airports or else turning them over to the Forest Service or something like that. So when this study comes forward, I strongly recommend you look at alternatives on some of these smaller airports and maybe a tax on all planes that have been carrying black market product out of the down south airport. Tens of millions, if not billions of dollars have flown out of there allegedly. So thank you for my opportunity to speak.
Any further public comment on the consent agenda? Seeing none, I'll bring it back to the board. All those in favor, please indicate by saying aye. We'll do a couple of proclamations when we've done that. All those in favor, if you want to take the vote after the proclamations. Okay. Well, let's give it a little oomph and we'll vote on the consent agenda just in case anybody changes their minds after the proclamations are read. So with that, let's go to a proclamation in support of mentoring. Supervisor Bohn.
I think Florence, are you here for this out there? Florence is there. I see her, okay. And her posse. And her crew. Okay, this is a proclamation from the Board of Supervisors recognizing, whereas this January is National Mentoring Month and provides an opportunity to raise community awareness of the importance of mentoring and recognizing the efforts of mentoring programs, the mentors, and their mentees. Whereas Big Brothers Big Sisters of the North Coast celebrates 51 years of service to over 4,000 youth in Humboldt County who have needed and wanted mentors. Whereas the future of Humboldt rests on the success of its children and youth. Whereas a mentor is caring, consistent presence who devotes time to a young person to help develop personal strength, achieve their potential through a structured and trusting relationship. Whereas quality mentoring encourages positive choices, promotes self-esteem, supports academic achievement, and introduces young people to new ideas. Whereas research shows that young people who are matched with a caring adult through a quality mentoring program are 46% less likely to use illegal drugs, 27% less likely to start drinking, 52% less likely to skip school, and are more trusting of their parents or guardians. Whereas youth development experts agree that mentoring is critical to the social, emotional, and cognitive development of youth, helping them navigate the path to adulthood, which is tough, more successfully. Whereas our community has many individuals, teachers, community volunteers, and so many others who support the mentoring movement and work selflessly to improve our children's odds for success. Whereas we appreciate all the efforts of these past and present local heroes and say thank you for supporting children facing challenging circumstances. Now, therefore, the Humboldt County Board of Supervisors does hereby proclaim January 2020 as National Mentoring Month and encourages all Humboldt County citizens to promote the creation and expansion of quality mentoring programs to equip young people with the tools needed to lead healthy and productive lives, and for Humboldt County residents to honor the role models in their lives by becoming mentors to youth in our community. Signed January 8th by our Chair, Estelle Fennell.
Yeah, okay. We'll do that from now on, because we used to not. Yeah, yeah. Oh, yeah, yeah.
Yes, thank you again. My name is Rebecca. I'm the president of the board of Big Brothers Big Sisters of the North Coast. And I wanted to share a couple of reasons that mentoring is important to me. The first being that I have been a mentor. I was matched with a youth in 2014, and she was just entering high school, so a very important time of her life developmentally, and she had just lost her primary care provider. Her and her siblings were all placed in different foster homes throughout the county. So we still stay in contact today. I'm very happy to say that she's moved out of the area now, but as an adult, she's working in emergency medical services, and she's going to school to become a nurse. So I'm very proud of her, and I was able to see her over Christmas break when she came back to visit. So I've personally seen that it's not only extremely beneficial for the youth in our community, but also for us who are matched as their mentors, and to see them learn and grow. And the second reason mentoring is so important to me is because I see it as a very simple strategy of prevention in our community. And we see all the statistics that the proclamation noted about people less likely to use drugs, people more likely to stay in school. But anecdotally, I work in behavioral crisis in Eureka, and on a daily basis come into contact with adults who have had zero trusted positive influences in their lives. And so I know how important this program is because I see the aftermath of when that doesn't happen. And I know that Florence and her team have been doing such an amazing job building the program more in this last year, and they have so many amazing things in store. So I want to thank the board again for bringing mentoring to the forefront. And also, we're really excited for Bowl for Kids' Sake, which is March 6th and 7th this year. And I'm sure y'all have heard about it because it's kind of a big deal in Eureka, but we are Enchanted Forest theme this year. It's our biggest fundraiser of the year, and it really is just a big party. We have almost 90 teams signed up so far to bowl, and if anyone would like to get more information or are interested in starting a team for Bowl for Kids' Sake, we have more information on our website, or you can call our office. Florence can add on to that and some other exciting things we have for National Mentoring Month this month.
Are we sharing this time? Okay. Woo! You're gonna, okay. She still had 30 seconds, right? Okay, so thank you so much. First, we just want to say thank you to you and all of Humboldt County for stepping up to support Big Brothers Big Sisters. We have so many bigs that have stepped up in this last. We had a 60 and 16 campaign through the end of the year, and we have so many people that are stepping up, especially men that are stepping up to match with our littles. But we still have littles that have been on our wait list for over 1,000 days. Think of yourself walking into, I had a 6-year-old who walked into our agency and so excitedly said, "I'm ready for my big." And my heart kind of broke because I know that the average amount of time that a young boy will wait for a mentor is 2 to 3 years. So 131 days today, I have multiple youth waiting for young people to step up, and mentors of all ages to step up and be in the lives of our young youth. Mentoring, as we know, is a great strategy. It's fun, it's engaging, it's supportive, and we're creating a developmental relationship, which specifically addresses the ACEs that we all know are soaring in our community. We are extremely excited to be part of the solution to support our youth, and we can't do it without you. So we're hoping there's a supervisors bowling team on March 6th or 7th, right? Because of course, when our leadership steps up, everyone steps up with you. So we do need those of you to step up. Because of Mayor Seaman's support, we have had countless mentors that have stepped up. Because of former Mayor Brett's support in Arcata, many males stepped up. So we are so excited to see those of you that are leaders to step up and step up big and come join us for a day, have fun. That's March 6th or 7th. And we also have, and it's our biggest and most important fundraiser of the year. It's 3/4 of our budget. So we do need people to step up, and we already have so many people in our community that are supporting us and continue to support us every year. So we want to thank you all for continuing to do that work. We can't do it without you, and we're really excited about the work we're doing. We will be calling out the names of the 46 youth that we have that are waiting a little later in the session. Thank you so much for all you do, and we look forward to partnering with you for 2020.
Thank you very much. Supervisor Bass?
Yes, thank you. I just wanted to thank Florence for her energy that she's brought to the Big Brothers Big Sisters lately. And there's a lot of changes that have been made. It's a lot easier to be part of the team these days. And perhaps another time she can come and talk about that. It's more like there's more ways to be involved. And I'm actually surprised at how easy it appears to be, just as getting the time and getting matched up to the right little. But really appreciate her energy.
Thank you, Supervisor Bass. Supervisor Madrone?
Thank you. Thank you for all that you do. Mentoring is so important. I've been lucky to have mentors in my life, and I try to mentor as many as I can. As far as the bowling, I think we want to add Ryan to our team. He's really quite a champion. So we're looking forward to it. I want to join in here.
Okay.
Go,
Supervisor Bohn?
Anyway, thanks you guys, appreciate it. I know all the years at Redwood Fields and still going on, how many mentors show up to their littles games and things like that. But I think the number in here is 47% don't do drugs, so we don't have problems. We make better adults. I mean, if there's people always going to say, what are we going to do about what's going on? What are we going to do about what's going on? Sound like you just got an idea on how to do it. Why don't you become a mentor? And I know if you've got a friend, they will let you share. I mean, you can be a dual mentor, because sometimes it's hard to make, but it's so important for that young little, whether girl, boy, it doesn't matter, that they're at their band, that they're at their band recital, their basketball game, whatever they do in a school activity, that somebody they know is there and cares, along with the parent they're with or the foster. So it's a big deal. So if you want to ask how you can make a difference, read the statistics. It'll tell you right there if you want to make a difference.
Thank you very much, Supervisor Bohn. And very quickly, could you tell us again how somebody who may not be part of this event might get some information about helping out a number?
Very quickly, you can talk to Jennifer Maxim, who is at our agency. 707-445-4871 is our number. You can also go to our website at www.ncbbbs.org.
Great, thank you very much.
Thank
Appreciate
you.
it. Supervisor Wilson?
Yep, just Brett tried to get me on a team, but I'm out of town, so I'm obligated to sponsor.
Oh, Brett.
But so I just want to let people know that, you know, if you can't bowl, sponsor.
All right.
So
That's
get in.
right,
Nice point.
okay.
Thank you so much.
You- when-
You can just press up.
If you guys want to email us the information, the poster, or whatever the
Yeah.
case may
I
be.
have it with me now.
And I'm just saying, and then between all of us, between our social media and things like that, we can get it out there and hit a few thousand more people. So
I'll send it
It's-
to you directly. Rex.
thank you. That'll be super. And you can always tell when the date is, because you don't have any friends in Humboldt County if in the fall nobody's giving you 40 pounds of zucchini, and then in February people are start calling you. In January, hey, will you sponsor me for $20? Yeah. So.
Point duly noted.
Thank you very much.
Thank you so much for your support and time.
So we have another proclamation here as part of the consent agenda, and this is in support of National Children's Dental Health Proclamation. And Supervisor Bass?
Thank you, thank you, Madam Chair, and I do believe there is I was going to say a contingency, but it looks like Laura's going to come up to the microphone and to accept this. So, a proclamation of the Board of Supervisors, County of Humboldt. Whereas the month of February marks the 20th anniversary of the Dental Advisor Group and is the National Children's Dental Health Month. And whereas the Dental Advisor Group is a diverse partnership that promotes good oral health for all Humboldt County residents, especially low-income adults and children. And whereas the Dental Advisory Group has helped bring oral health resources to our community, such as the Humboldt Health Foundation Dental Angel Fund in 2000, the Circle of Smiles Initiative in 2001, First Five Humboldt and the Mel and Grace McLean Foundation Awards in 2014, the Dental Transformation Initiative, also initiative/local dental pilot project and Proposition 56 funding in 2018. It's a lot of things. And whereas the Dental Advisor Group is the place for professionals to learn and share information with the goal of preventing dental disease and supporting children to grow into cavity-free adults. And whereas National Children's Dental Health Month is an event that promotes education and the awareness along with our local Smile Humboldt programs, highlighting the idea that the power is in your hands to embrace healthy habits and to make and keep dental appointments. And whereas tooth decay is the most common disease found in children and is avoidable by brushing twice daily for 2 minutes using fluoridated toothpaste, flossing daily, having routine checkups, and eating a diet low in sugary foods and drinks. And whereas our county supports systems changes for better access to fluoride varnish, dental sealants, and fluoridated water regardless of income. And whereas the cooperation and advocacy demonstrated by the Dental Advisory Group, the Oral Health Leadership Team, and many additional partners represent the strong commitment to meeting the oral health needs of Humboldt County residents. Now therefore, the Humboldt County Board of Supervisors hereby proclaims the month of February 2020 as National Children's Dental Health Month, and recognize the significant long-term work of the Dental Advisory Group and calls upon the people of Humboldt County to use and promote good oral health habits and encourage family and friends to do the same. And this is signed by Chair Estelle Fennell. But again, it's not passed yet, so I don't know.
Thank you so much. Well, thank you very much. My name is Laura McEwen, and I'm the HHS Program Services Coordinator, and I see the oral health programs at Public Health. I'm honored to be here today, and I'm so appreciative of your proclamation, and I'm also appreciative of the many partners who have worked over the last 20 years to improve the oral health of the Humboldt County. Oral health is an important component of overall health. Dental decay is preventable. Our vision is that communities thrive because oral health is valued as an essential to well-being equitable opportunities ensure that everyone has optimum oral health. February is the 20th anniversary of the Dental Advisory Group, an important collaborative of oral health partners that has led to a number of important initiatives that the supervisor noted. February is also National Children's Dental Health Month, a month to raise awareness about the importance of children's oral health and how simple daily procedures like brushing 2 times a day with fluoridated toothpaste and flossing daily can prevent cavities. As we say in our new marketing, the power is in your hands. So thank you very much.
Thank you. We're definitely talking about creating a better future for our kids in all of this, and so thank you to everybody with your efforts here. So with that, we have a motion and a second. All those in, Supervisor Madrone?
Thank you, Madam Chair. Is Sydney Larson or Diane Pecora here today? I didn't think that they were, but I just wanted to say how much the Board of Supervisors would like to thank both Sydney Fisher Larson and Diane Pecora for their service on the first 5 Humboldt Commission. They both served for the past 6 years, and they've done an excellent job, and we're going to miss them in that role. So I just wanted to put that into the record. Thank you.
Absolutely. And with that, oops.
Just want to say, if people, I've been on the First 5 board for 3 years now, and they have been stalwarts. And I say that board is one of the best boards I've ever been on in terms of like the accountability at all levels, especially even financially. I would say that just every dollar is squeezed for all its value in terms of the community. But I want to, if people are going off, that should be a call out to folks who are interested in First 5 issues to be considerate of, maybe consider joining the First 5 board. And so I want to just make sure that that's in the record as well. Thanks.
Thank you, Supervisor Wilson. Supervisor Bass?
Thank you, Madam Chair. And I would mention that item 5 also has that we have 2 brand new members coming on board, but I believe there is another opening that's coming up as well. I attended my first meeting, and we're already working actually with CSAC to try to see if we can get a challenge award that might be reflective of the type of work that is done with First 5, and so it's really exciting. So.
Supervisor Bohn?
Nobody wants to die. I was on the board, and then I was the alternate for quite a while, and I really appreciate the transition in leadership that we have had. Thank you. And if you look at ACES scores, if you look at everything we do, everything comes back to First 5, and it's absolutely amazing. I've got 3 grandkids, 5 and under, so I can tell you pretty good, and their little gift baskets are cool. But the whole idea behind this is everything that's taking place there is over and above what our children need, and we keep saying, we have to do things. And we had with CSAC and then RCRC, when they had their annual meeting up here a couple years ago, we had the head of, that was our focus, was First 5, because in rural counties like ours, it is sometimes our only resort to making sure that we have a follow-up. So I want to thank everybody at First 5, and I appreciate you guys for serving, because it is a pretty cool board, because it's a lot of people that just care a lot. So.
Any more discussion? Okay, with that, we do have a motion on the table. All those in favor, please indicate by saying aye.
Aye.
Opposed? None? All of those have passed unanimously. So with that, we'll go to items pulled from the consent agenda, and the one that was pulled was C7, a letter in support of pediatric and obstetrical services for Redwood Memorial Hospital. I put that on the agenda. Supervisor Bohn pulled it for discussion.
And the reason is the letter went to State Attorney General, and the hospital leadership was unaware that we were sending it, and I apologize for that. But I would like to hear. I've got a niece that works in the OB department at Redwood Memorial. All 3 of who I mentioned, my grandchildren, have been born there. So I feel in 2016, we went to a packed river lodge and realized that, You know, so the OB department for the Eel River Valley is important, but I think discussion and where we want to be is even more important. And I think we missed maybe we didn't, maybe we did. I know people were nervous, so that's why I think it needed to be pulled so we could get a full explanation of what's going on. So I pulled it. I had some phone calls back and forth. Got a phone call about wanting to, you can't hear a whole story until you hear both sides of the story. So and I thought everybody on the board would like to hear, about, infrastructure improvements, things that are happening and recruitment and how this, sometimes this could affect recruitment. So that's why.
No, I thank you, Supervisor Bohn. I also spoke with Christian yesterday, and it's going to be great to hear what you guys have to say about obstetrics and pediatric services at Redwood Memorial. Thank you.
Thanks for having me here today. I would say that as a community, we face numerous challenges in how the depth and breadth of our healthcare services. And so my hope is that we can work effectively as a community together and definitely prefer that if action's taken on behalf of the Board of Supervisors, that the hospital always have an opportunity to have that conversation. And so that's why I'm here today. To be very clear about some basics, there is no imminent threat to women and children's services at Redwood Memorial Hospital. The hospital is fully prepared to fully honor our obligation under the Attorney General's requirements for pediatric and obstetric services. What has changed, and what you no doubt have heard about, is that the environment of care has changed. So the legacy of Redwood Memorial was predicated on some things that we had years ago when we had Dr. Jack Anderson, who would be practicing probably 365 days a year, commitment of pediatricians who would take call. It was a model that I can't reproduce today. So that what's happened in recently is that we've had changes in obstetrics and gynecology across Humboldt County. As we've had people leave the market, I have to bring in and do temporary obstetricians to help cover call in the Eel River Valley. More recently, what happened is we had two pediatricians who would take call for the hospital to see newborns, especially a newborn in crisis, but even normal newborns. And they've given me notice that they're no longer willing to keep taking call, despite increases in call coverage pay and things like that. It's just a lifestyle decision at this point in their career. And they found that, so they won't be able to take call after May 31st in any routine way. What they noted is that it actually has negatively impacted their ability to recruit more pediatricians to the community, that today's graduates of pediatric programs may want to do outpatient pediatrics without hospital call. And so in order to meet the requirements of the Attorney General, we actually have been working on bringing in temporary pediatricians to cover that as well. So I think that what stimulated the discussion was those changes. And if you look across Humboldt right now, there are changes occurring in Women's Clinic at Mad River. There's changes occurring even in St. Joseph Medical Group with some departures. And Open Arms, the private practice, is also in some flux. And it's pretty clear to me that an effective solution for women's and children's services in the future will be best done if all parties who have a role in that collaborate to come up with a model to serve the most people the most effectively. At St. Joseph Health, we are very committed to caring for everyone in this community through a wide range of specialty services. And as part of our normal process, had shared with the medical staff of Redwood that we wanted to do some visioning around, how do we do everything for Humboldt County, not just women's and children's, but globally. How do we use our resources most wisely to have the most impact, create the best health, and create the best future? I know the letter raised some questions about certain services, and I want to just clarify that. Mammography was temporarily interrupted when our only mammogram tech at Redwood had a tragedy in her family and required immediate and prolonged leave of absence. She's back at work, and we've actually expanded our hours During the interim, we made sure that we had a way to still do surgical biopsies at Redwood, and women were served primarily at St. Joseph in the community. That was unforeseen and speaks to the fact that in a small rural community, when you're looking for people who are licensed in California, have the credentials in the highly regulated mammogram market, that even when we sought temporary help, it took a number of months to find them. We did find them, but there was a period where there was a gap. But it was because we were treating a longtime worker with tremendous respect after quite a tragedy. It was suggested in that letter that there was a question about the level of support at Redwood and where we're making investments to maintain services, enhance services is important. We're investing over $11 million in building a new rehab unit. It will bring jobs, clinical excellence to the Eel River Valley. We've already expanded physical therapy services to include much more robust chronic pain management, Parkinson's, outpatient physical therapy. As I said, we've extended mammogram hours. We've very importantly added 2 general surgeons, 1 full-time, 1 part-time, to the medical staff through the St. Joseph Medical Group. Those surgeons are able to do colon cancer screening with screening colonoscopy, and they do surgical procedures. It's a huge enhancement to the facility. And a question came up about palliative care, and in the last year, we've expanded the palliative care team across St. Joseph and Humboldt to include a physician, nurse, and a social worker. That's a new investment in services. And while that group is based out of St. Joseph and Rico, just based on the volume of patients each place, they've already done consultations at Redwood and are available for consultations as needed. So I think that it is really important as we look to recruit. We are actively recruiting physicians and nurses to Humboldt County all the time. We've had some major successes in the last year, and we have some ongoing challenges. How we present, how we work together to the community, to the media is important, because frankly, if we're always arguing in the newspaper, a doctor who might think about coming here may think twice and just go someplace where people work together to meet the challenges of healthcare that people are facing across the nation. So I wanted to make sure you had an opportunity to ask me questions and that you had the facts. There is no immediate threat whatsoever. We are fully prepared to honor the AG's requirements, and yet the services in Humboldt do need all stakeholders to work together.
So, thank you very much. I really appreciate your unfolding and peeling away all the layers that might be out there and letting us know what you're doing. But I have to reiterate, in 2016, when the concerns were raised earlier about the OBGYN services and pediatric services, the River Lodge was full to capacity and out the door. In a matter of days, the Eel River Valley responded to that call. Babies were crying in the background, etc. It really, really was a fundamental exhibit of the concern that's out there in the Eel River Valley. So my question is, Dr. Barrett, who's the outgoing health officer, wrote a letter of concern. The concern that I hear is that the AG's arrangement was to go to 2021. So they're thinking ahead. They don't want it to come a few days before anything. So can you give us any assurances that this will be expanded as of 2021? The whole idea, I think, of the doctor was to make sure that the AG was aware that that was a concern for the Eel Valley.
Yeah, certainly in 2016, I know there was a passionate outcry from the community. I think that what our next step is really some visioning, including community, medical stakeholders, others, about kind of the future that looks at all the aspects of care that really is centered on the safety of the mom and baby. And it would actually not be in the best interest of the moms and babies for me to just say, okay, we know we're going to continue this no matter what. Rather, I'd prefer to bring together key stakeholders and look at what does it take to have a quality program. the questions that could be asked are, is it better to drive, another 20 minutes to have a pediatrician who's in a level 2 NICU if something bad happens to the baby? Or are we really confident that the pediatricians that we get to work just temporarily, because none of our Eel River Valley pediatricians are going to do it, are the kind of pediatrician you want if there's a problem with a baby? So the questions are deep, and they're really about quality and service. This is not an economic decision. There are economics to it, but that should not be the core of what we do. Many places across the country look at services with low volume and raise the question, are we developing the kind of quality that these moms and babies deserve, or adults in other service line, by having multiple small programs? What is the best way to ensure that they're safe? And there's no place where the stakes are higher than in a baby. I will say that that with this service line and others, it is important that we pause and have a thoughtful deliberation about this, and that's what I will commit to.
That's reassuring, and I think that you're probably aware that the City Council of Fortuna also sent a letter to the AG. So I think that, as with all tough decisions to be made, it's really important to get in there early and for everybody to talk. I agree with you 100% on that, so thank you so much. Any other discussion from the board? Supervisor Bohn.
And I know, I think there's a new midwives office in Fortuna, and that you guys had recruited a couple.
So yeah, I forgot to mention that, Rex. Thank you for. There's a couple of things we did. So when in terms of our level of commitment, when Dr. Anderson's practice became unstable, the St. Joseph Medical Group hired Dr. Tatiana Shereshevsky, made that commitment. In addition, we've hired nurse midwives for that area, so that there have been commitments made to care of pregnant women that are substantial already. And so there's some of the things that I'm so used to seeing it, I forgot to actually mention it, but that was an important move. We collaborated with Redwood Women's Health Clinic. We've done a lot of work to try to shore up the program that is there and expand. So we've got some superb nurse midwives down in the Eel River Valley right now.
Well, and it has changed so much over the years, because I think your partnerships with Open Door have flourished by the looks of the facility in Fortuna, the new and improved facility in Ferndale. And you guys don't compete, you guys work hand in hand to provide medical care, and they'll be in on that discussion also, I imagine.
Absolutely, we've already started those discussions. So one of the other things that is not, it may not be obvious, is we have great practitioners to do deliveries, but when you have a nurse midwife or a family medicine doc who doesn't do cesarean sections, you always need an obstetric gynecologist, surgically trained person on call, 24/7, 365 days a year. As many programs as you have that are hospital-based, each needs that, and then each needs a pediatrician. So, so we have layers of care, but the piece that we have less of, especially, is the OB-GYN piece. We've got fabulous nurse midwives, that we've got family medicine docs who are interested in delivering care. And we actually made a substantial donation just to build the Open Door in Fortuna and to maintain the one at Redwood. So it is a partnership, but, and they will be at the table in this discussion, absolutely.
With that, I would open it up to public comment on this item.
Morning, Dennis Leonardi. I'm immediate past chair of St. Joe's board, and I had a bunch of prepared remarks, but Roberta covered most of them. Now, one of the things I wanted to share with you, and I think it's important, because healthcare is a county service. I mean, it's and to invite all of you, if you haven't done so already, St. Joe's offers like a 4-hour, very in-depth tour, not only to see the facility, to see what we do, but more importantly, to understand the regulatory and the reimbursement financial structure that healthcare works in, because it affects all of us, not just the hospitals, the practices, Open Door. To have that knowledge, so you can understand what we're up against when we are trying to recruit, when we're trying to support the medical foundation that we have that keeps top-rated physicians here, having that grasp of knowledge and spend a little time to try to understand the vision that we're looking forward. I mean, we'd all like to go back to the good old days when Doc Crane would come in and do rounds in the hospital, take care of you. Well, doesn't happen. We have to have hospitalists take care of patients. We have to pay for call. The economic drivers have completely changed. And in order to, and it's not just us, we're a partnership like you talked about with Open Door, but there's also the county. This has to be a comprehensive delivery system because we're not going to make much of an impact in drug addiction or homelessness or improve or expand services or bring the most modern technology to the community unless we cooperatively and collaboratively work together. So immerse yourself in a little bit of healthcare, and it's not self-serving for the St. Joe's organization, it's self-serving for us as a community. Because you never know, I mean, what, a year and a half ago or 2 years ago, level 3 trauma, have you guys spent some time to know what that really is about? You bump your head or your family member and you've got 24/7 neuro coverage. You're feeling a heart attack coming on, cath lab, understand what we're doing to move that forward to the next level. What, 30 minutes from presentation to STEMI, something like that? Incredible numbers and incredible services. The outcry, and part of the outcry at Fortuna was physicians. Sorry, I'll be done in a second. Family practice residents, nobody else stepped up to do this. We saw the need, collaborative approach, nursing program at Humboldt. So really, I think make it a priority somewhere is what I'd like to encourage you to do, to really immerse yourself and to bring the community along, because it not only is an education, it also takes philanthropy. When you understand how the funding works, philanthropy in this community, which is extremely generous, makes a difference in getting the latest tech, the newest recruit. Anyway, thank you, I appreciate it, and really take me up on that offer. They'd love to take you around.
Thanks, Dennis.
Hi, Connie Stewart with the California Center for Rural Policy. It's all been said, but essentially, you know, we have a table that's set, and this community is really working together to work on our healthcare issues here, and things pop up, and there's always a crisis, but we have a table. We just met yesterday. Everyone was at the table talking about how to solve problems together, and I don't want to go back to the days where we just throw hate missiles at each other because we're concerned. So you have representatives at that table. Please come to us with questions. And if you want us to do more presentations on all the amazing things that we're doing together, but it took a long time to build trust, to put that room together so that we could honestly talk about our problems and work together to solve them. And I don't want to see that energy destroyed. Legitimate concerns, please, let's work together to solve them. This week and in the next month, we have a lot of docs that are going to come through this community, right, to decide whether to work here or not. And like Roberta said, we need to show them that we're a community that is struggling but working together. And you know, we have folks coming from Open Door that want to work in the Eel River Valley. So we really need to show a united front. And you know, 100. They just reviewed 100. Folks for the residency program, family residency program. It's amazing what we've accomplished in the last 18 months. So we'd love to come, and maybe it's our fault we're not doing enough about promoting all of the stuff that we're doing to solve the problems of healthcare, and we'll do a better job at that. But please, don't send this letter. Thanks.
Let me just take the rest of the public comment, then you talk. Oh, yeah, okay, you can go ahead.
Connie, you talked about, and since we just they're getting their feet wet, the 6 new residents, and I don't know if we pushed that enough. I think 4 of them have bought houses.
Yeah.
That's a huge thing. 3 of them have picked specialties that are lacking in Humboldt, so it makes an effort.
And
But-
one of them is from Humboldt.
Yeah, exactly.
Yeah.
Wildridge. But anyway, but the main thing is I think we had 11 or 1,200 applicants for the first round. Did we really have over 2,000 applicants for the next round of 6 residencies? I mean, that's amazing to me that 2,000 people would love to come to Humboldt.
Actually, we had about 800 applicants, or over 600 the first time. We've had over 1,100 this time.
Okay.
But I will say that I would like the board to understand the vision, dedication, financial support, and work it took to launch this program. This is huge. And so if it is hurtful that there's questions out there about our commitment to this community. There's been huge work accomplished in my 2 years here. There will continue to be huge work, but I do need support and collaboration and open, honest communication. When the AG gets letters like this that creates a sense of mistrust, it harms all of us, especially when it's unfounded.
Welcome.
Ken Sawatsky. I wish we could have cloned Ted Humphrey. I don't know of you, but having been my wife for many years, over 30 years with Ted there, he was the 365 doctor, faced the same thing these people did. He could only get a part-time person because he had to do the rounds, I think, at 2 of the hospitals here. He was the main one who did the rounds. Always was flying down south with the kids on the planes when they had to get out of here. But things have changed, haven't they? The biggest problem I see in a lot of things is these letters. People don't understand the impact of what they are. With social media these days, anything negative gets out there. And I know all kinds of people who had just something, they would Google something, find an article in the paper saying homeless issues up here are major, and there were some derogatory things in an article. That's enough for people not to want to come here. I know probably what these people will have to use is a lot of locums. And my wife worked with a lot of those who worked in pediatrics here with Open Door. I strongly applaud all these people working together because that's what it's going to take. It's going to take the whole medical village to do this. So I would honor their request. I would do whatever you can. We have economic development. We have money. When we have people coming to an area like this, we should be able to do some whatever you call whining and dining, putting our best foot forward. We should have a group willing to participate with this where all of us can get in and let these people know they will be appreciated if they come here. We have a lot of negativity in Humboldt County, which we have to go over the top of. We're all painfully aware of our ACEs scores and everything else. The people go, oh boy, I don't know whether I want to step into this hornet's nest. So it takes all of us working together. Whatever their request is, I would follow. And in the future, when you have letters and things you send out, sometimes there can be unintended consequences that you won't be aware of. But just be aware of every little bit of this is observed by everybody else out there who may want to come here. And unless we need to be honest, but we also need to make sure that they feel extremely welcome. So thank you for my opportunity to speak. And thanks for what you guys working together. That sounds fantastic.
Welcome.
Good morning. Didn't think I'd speak on this. First request is anytime you pull an item from the consent agenda and have someone argue in favor of it, that you hold them to that same 3-minute time limit or give everyone else the freedom to speak longly if it's not a presentation, something I'd speak. I just read over the letter. I didn't read anything else. I had 2 children born at Redwood Memorial. I support you guys in sending a letter. You need to fight for Southern Humboldt. I'm from Southern Humboldt. I was born in Garberville. They don't birth children there anymore. Now they birth children in Redwood Memorial. I've read a lot of things that there's a possibility of losing those services. To fight for citizens of Southern Humboldt, send this letter and hold people to their time. Thank you.
Thank you. Any further public comment? Bring it back to the board. Supervisor Madrone.
Thank you, Madam Chair. First, I want to say thank you to St. Joe's for all that you have done and continue to do for our community. And I appreciated you, Ms. Luskin-Hawks, reaching out to me over the last several months, and I appreciated the time we've spent meeting, talking about issues. I know that things are not easy in the healthcare profession today for providers or for recipients. It's a difficult time that we're going through. But I really appreciated that time talking with you and learning more about the services, and I certainly appreciate all the work you do in our community. That being said, I am concerned about a lot of things, and I got a lot of documents from the basement going back to the 1970s, and just kind of trying to understand really what's happened in regards to our healthcare services, how things have changed from General Hospital to St. Joe's, where we're going. From some of the things I've heard here in your presentation in regards to the letter, it seems to me that we could potentially change the letter to be less negative and more positive, in the sense that we could say the hospital faces a possible threat of losing rather than an imminent threat. Because what I heard you is you're not committing to maintaining that after the year runs out, but you're committed to having the conversation about trying to figure out the best outcome. And so in a way that leaves us as a community wondering, is the service going to be here or not? And for those folks in southern Humboldt and the Eel River Valley, this is huge. And I know it's only another 20 minutes or so, but 20 or 30 minutes sometimes in pediatrics and obstetrics can be a life, literally. I know these things because my wife, some of our babies were born as VBACs, vaginal births after cesareans. And you're in a really critical situation with those kinds of things, as well as many other types of conditions for children and women. So I think that the letter could be reworded a little bit to just make sure that what we're saying is that we want to make sure that we're able to continue to provide this service in the community. And so some modifications to the letter I would certainly support to try and make it a little less negative and a little more positive, in hope of that we're working these things out. I was always confused as to how the transitions worked in this community from General Hospital to St. Joe's, and how services have changed over time. And so I did a little research, and it was back in 1975 that the Humboldt Medical Center, which was owned by County of Humboldt General Hospital, was transferred over to Brim and Associates. And in that transfer, Brim and Associates agreed to maintain the indigent care for the poor in our community. That was a very important consideration, along with pediatrics, obstetrics, all these other programs. They were really important. And so as we transferred from the county to Brim and Associates, they signed an agreement to maintain that indigent care. And then in 2000, St. Joe's took over that agreement. And they were also being asked to agree to maintaining that indigent care. And there was a comment in 2000 on the staff report that said, not wanting to hold up the sale, General Hospital's corporate counsel has proposed this assignment be taken, the assignment of indigent care, be taken to the board for them to consider an assignment of indigent care to St. Joe's healthcare system, except for that portion for which St. Joe's ethical and religious directives will not allow the provision of. So for instance, vasectomies, tube ligations, other types of birth control treatments, you were not willing to take that on for the indigent or even anybody in our community. And it states that with assurances that the remaining indigent care will be provided locally by Planned Parenthood and the Mad River Community Hospital. And when we look at what's happening with federal funding for Planned Parenthood, it's disappearing. Their ability to provide these services to our women in our community are disappearing. Mad River just shut down a whole bunch of clinics, doctors are leaving. This is huge. And so with St. Joe's not being willing to provide that care, which at the time, the board at the time agreed to this limitation on the transfer of those requirements because there was a robust Planned Parenthood Mad River Hospital to provide that backup for those things. We're not in that world anymore. These things have changed dramatically. And I have very serious concerns about how this is going to pan out for our community down the road if this religious and ethical directives prevent you as a hospital, which is no longer really Sisters of St. Joe's, it's now Providence. The sisters aren't even alive. And this was the first hospital they built, right? So there's this legacy here with this hospital. But as it took over General Hospital, there was also additional stuff in the 1975 documents that talked about these serious concerns about a proposal at the time to shut down the ER room at General Hospital. And there was a lot of documentation in here that talked about, oh my goodness, we need both. You know, we need more services rather than less. So there was a lot of concerns expressed 45 years ago about collapsing services, which, as we know, that's exactly what happened. Generals shut down. Yes, the tower got built and you expanded services, and you've added some tremendous services and facilities at that hospital over those years. Financially, when you took over General Hospital and other things that were happening due to Medi-Cal billing procedures and other things, St. Joe's was on the ropes financially, as we all know, back in the early 2000s. And the community rallied to the support of St. Joe's to the point of helping raise a massive amount of money to help financially support the overall operation. So the community's been there, you know, for St. Joe's to try and help keep it on sound financial footing and the rest of it. And eventually that particular group got turned into the St. Joe's Advocacy Committee that was really there for you, you know, in financial times and financial troubles. So I look at all those kinds of things and I worry about where we're heading with these services in the Eel River for women, et cetera. And you know, back in the early 2000s, there was a lot of talk in here about difficulties with the unions, the nurses union in particular, and trying to come to some agreements, you know, on labor stuff. And here we are again, 2020, having the same sorts of problems. And when we spoke, you mentioned how the negative public relations and other things are having a dramatic impact on people seeking services at St. Joseph's, which then hurts the bottom line even further. And it's sort of this unraveling problem of people not seeking services because they hear negative comments about staffing levels, they get concerned. And I'm certainly not raising this up to try and create problems in the media for you or add to the issues of concern in the community in that regards. But the longer these kinds of things, as I explained to you, go on, the more people, their trust, you know, dissolves. And so, you know, I would like to offer that we put this all to bed, you solve your labor issues, come to the middle with the unions. I'm not going to get in the middle of the negotiations, as I told you before, but if we can get that solved and we can have a firmer commitment to the community to cover the services that are needed, including these obstetrics and pediatrics in the Eel River Valley, then we as a community will once again rally to you, come to the hospital for services, will feel safe, and we can turn this thing around, but it takes partnership, which is what you're here talking about. So I would be supportive of amending the letter to make it a little more positive, but I do think it's important that we go on the record saying these things are really important to us. So I guess that's kind of where I stand with this. I appreciate the letter being brought forward. And I think it's important that we set the stage for protecting the community in this regard.
I want to say something before I give Supervisor Bohn an opportunity to speak as well. I see a little mission drift here. We're talking about completely different situations here from my colleague on the board, but also from St. Joe's. We're talking about surgery and this and that and the other. This letter is specifically about OBGYN and pediatrics, which is extremely important for the Eel River Valley. And you heard local residents saying that we don't even have those services at Garberville anymore. So I think the bottom line here, and I'm kind of disappointed, in fact, by the tone of, I think it was Connie said, you know, we would destroy teamwork. Why would we destroy teamwork by saying that we want to retain OBGYN and pediatrics? We're talking about teamwork. I think that saying things like that and saying this letter is negative and saying this, that's what pulls us apart. This is a letter wanting to assure that the Eel River Valley has those services. The last time the issue came up, it was up to the Attorney General to put it into the agreement with Providence that that would continue. What the residents of the Eel River Valley are asking is that if it comes to this, the AGA can be involved. And I know that I'm kind of surprised at the pushback. Don't send it to the AG. The AG was a very important part of this agreement. So everybody work together. That's what we'd really like to see happen, and not to be said that we don't want to include the AG in this discussion. Supervisor Bohn.
And I appreciate that. Supervisor Madrone said, I'd like to add those things to the letter. You said so many things, I'm not sure which things you're talking about. But I think the whole idea, and remembering back, consider, I lived next door to the hospital in 1975, and I'm trying to figure out why the county ever got rid of that building and traded, but that was beyond me. But as we move forward, I think we see a pattern here. We can't find deputies. We can't find guys to work on our roads. We can't find people to work in our engineering department. We can't find. There is a workforce dilemma, and then when you throw a workforce dilemma that needs 6 to 8 years of training, and an 8-year commitment, and a $250,000 medical bill coming out, and you talk about the advisory committees that have turned into the foundation boards now and everything else, and I've been to too many and done a few fundraisers for the commitment from the community to our health system all the way across the board, both for Planned Parenthood, which is over the top, both to, the St. Joe's and Redwood Memorial. With that, and the indigent care was primary for the Sisters of Orange. If you read their history, that was why they opened initially up here, because that wasn't a big thing to open a hospital. Connie made some really good points about the way we approach this, because they approached this in a different way in Crescent City, and they approached this in a different way in Trinity County, and they're suffering the realms of it now of trying to get people to staff their hospital. So I would like to, I don't think it should be rosy. As I said, I've got 3 grandkids that have been born at Redwood Memorial, enjoyed every one of the experiences. I've got a niece that works there now, and and she has major concerns, and I would like to see those with all the other people and the people of the Eel River Valley, and Southern Humboldt provide those services. I truly think, it's always going to be the worker against the administration. We see it up here all the time and everything else. A little more outreach, maybe, just to let those people that give them an idea how much you're doing to try to save that, because I don't think anybody wants it to go away. But I know I know even at St. Joe's we're using flyers or whatever for the pediatricians and stuff like that, which is a major financial commitment, but it's a commitment to Humboldt County that they're making. I've lived across the street from came all the way from Oklahoma, so and served a year here. Dr. Stokes, I would love to have as much money as he has spent on his own dime trying to go out and recruit for Humboldt County. So the doctors that are here and have been here long term, I remember Dr. Anderson led the charge in 2016, and it was the importance of Redwood Memorial. So I don't know where we go. I really can't get involved on the labor end of it, and that I think that's just a little far, and I can understand, and I think that will work itself out, because it seems to always does, and hopefully to the benefit for everybody involved. But I do think we need to let people know, and it may be, and I had the advantage of talking to some of the people at the hospital. It may be them falling down a little bit on letting their people know what's going on. But I think as you go into the archives, and for some of us that lived that back in the 70s and have been around and have gone to the community support events and things like that, the community support's there. It's just we need the residency program, the partnership, the millions of dollars have been sitting on the residency. There's actually going to be, there's coming forward, there's going to be some grant opportunities for these residents so we can get them here. And that's huge. I don't think we publicize that enough. 53% of all residents stay where they do their residency. So we have a 6-year, we got 30, so we're going to have 18 docs in the end of 6 years that are here. They're young docs. Their kids are going to be going to school here. They're not leaving once they get their feet dug in, because they're going to buy a house. And they're excited to be here, and they're doing something. Just so you know, on the resume, I know we're drifting. I apologize, but when those 1,100 applicants, they're not getting them from downtown LA. They're going to the rural hospitals. I had one of the residents. We had a reception for them and a barbecue and everything for them, and one of them says, I'm just happy you have a Target here instead of you don't have a Neiman Marcus. So, I mean, that's the benefit. So these things, these are positives. But if we can make sure, nobody can make a commitment that says we're going to keep it. I think the commitment we're going to work our tail off to keep it is important, because if we're going to do that, when we passed Measure O, we said we were going to have a fully staffed sheriff's department. We can't make that promise because we can't find the people to staff it. So this is where I come from. I think the best effort we can do to make it happen and to assist all the medical health professionals to do it is where we need to be.
Supervisor Bass?
Thank you, Madam Chair. Before I say what I was going to say, Supervisor Bohn, I'm trying to determine if you actually support sending a letter or not. Because I'm kind of basing what you were, I was going to respond to bring up some of the same concerns, but can you be a little clearer?
I think the best comment was made. We have tables for a reason, and that's for all of us involved to get around the table. So maybe we don't downplay it, but we address our concerns a little bit different, because they haven't sent out notices.
Right. No, and that's what I was trying to distill it down to, because I'm in the same place you are from the standpoint that we do have people at the table. I believe Supervisors Bohn and Madrone actually sit on the community meeting now. I don't anymore. I do think there are opportunities. If we wanted to send a letter, I don't think I'm terribly supportive of sending it now. I would want to take it back and see what else is important for us to put in there. And I respectfully disagree with our chair, in talking about, disputing what Connie had said, because teamwork is letting people know what you're doing. When you can. We can't up here because we have to hash everything out in front of everybody, right? You can have one other person, but we have these people working in teams together. It's not perfect, but I think that perhaps this could have been, maybe reworded, add a few more things, and had more of a buy-in. So I do feel it's unfortunate that we have to be hashing it out up here, because I think it is right to be concerned. I remember going to those meetings in the past, and I was amazed at the turnout. So you do have to fight for what you want. But I'm also hearing that this is not something that it is imminent. So, is there a time limit that the chair wished to send a letter?
No, actually, I believe a copy is already on its way. And that was why it was on the consent agenda, because I made a mistake to think that there would not be support for OBGYN and pediatric, and having the AG be a part of the discussion.
Actually, and I'll also respectfully disagree with you. It's not that there's not support. It was just a different process that I would have preferred.
Well,
because we can't undo it.
Well, if we'll put it to a vote. If let's hear what Supervisor Wilson has to say.
Interesting.
Okay.
No, go ahead.
And I don't see this as I would have to agree with Supervisor Bass on, I don't think there's anyone that doesn't support those programs, and I think that's pretty obvious. So I don't think the sending of this letter is a measure of whether you support or not support those programs. I think that's I think the question is to whether or not sending it, which has already been sent, whether it's strategic to do so in support of those programs. And it's like we have these discussions related to homelessness programs too. We have discussions about whether one strategy or another is better to get to the same endpoint, which is support for those services. So I think the question that's being posed to us today is whether or not the language as it sits is strategic, and even the fundamental action is strategic in keeping those services and wanting those services to stay. So I think that's a reasonable argument or discussion to have. So there was a proposal. I mean, even though sometimes things get sent, sometimes amended letters get sent, and it does happen. It's a thing, and I think it seems like, since it can't come back, so I think that the concept proposed by Supervisor Madrone, which is the, an amended version of this to sort of update maybe or even clarify the feelings of this community with relationship to this issue might be something that's reasonable. I think that, that amended letter might use terms like concern and cautious in terms of how, in terms of why we would want to send a letter as a community, but it should also have words and concepts like cooperation within the entire community and how and demonstrate some of what's been happening to try and move those things together. And then also appreciation, which I think Supervisor Madrone spoke to as well in terms of what has happened both at St. Joe's and the other providers. And so with those things, I would propose that Supervisor Madrone and Supervisor Fennell kind of get together and spin out a kind of more positive update to the AG's office, so that both reflects that concern in terms of that we have and the cautiousness, but really reflects back to our community the things we do appreciate and the things we really are working on, and sort of the positive nature of those discussions. And so that's kind of where I would leave it, because again, I don't think anyone is not supportive of these programs wholeheartedly.
Yeah, I'm saying I didn't think people would be not supportive of sending a letter. So obviously what I'm getting, and we'll see if that's the case, that the board might be supportive of sending a letter if the wording were changed. And if that were the case, I would be happy to do it. I think my reflection of the discussion here is that we want to emphasize the recommending teamwork, inclusion of all stakeholders in future discussions about OBGYN, and maybe removing the word immediate and saying potential threat.
And I want to make sure that it's recognizing the work that's being done or that has
Exactly,
been done.
yeah.
It's not just pushing forward, but really in recognition of what exists in terms of that teamwork today. Again, reflecting back on both showing our support and concern with regards to these programs, but also our support for collaboration that has happened, that will happen, so that, again, we're reflecting back on people who are both coming to this community and people within this community, that those things are important to us.
Mm-hmm. Supervisor Bohn, thank you.
And I think you hit the nail on the head, so I'd almost like to maybe see Supervisor Bass and Supervisor Wilson work on the next letter. You talked yourself right into it, because I think you bring a perspective of what's going on in Mad River. I think we can all bring a perspective that what's going on in the healthcare systems in the rural, not just urban, but rural healthcare throughout the nation is absolutely atrocious, and we are all fighting for these people. That's why the work on the residency, and you're right, the commitment that they've done. I don't know if anybody realizes I'm on the EMS board and have been for quite a while, but I don't think anybody understands how much money was invested, and by other hospitals, but St. Joe's to go to their trauma level that they are, Mad River, it is a financial investment that you can't believe, and then having 24-hour, care available for extreme trauma is huge. And it's extremely huge when your family does suffer that. The first thing they're not doing is they're not flown to Redding or Santa Rosa. So I would like 2 new sets of eyes with a condensed version of just covering what we're covering.
No, I'm gonna, I have, with all due respect, I represent the Eel Valley. I represent that area, and I would like to have a part in this. And I think it's, of course, it's the job of the chair to sign what the board agrees on. So let's see what that. I mean, I really, really think that that's not appropriate.
I don't know where to go with that.
I do whatever you want.
Supervisor Madrone?
Well, let me take a crack at this, so we can get the business done. So, in the first paragraph, I would remove immediate. So it would still say that there is a threat, because I think there is one, and I think you expressed that well. I would then put a new paragraph in that says, we want to work cooperatively to provide effective and timely health care for our community and include all stakeholders in the discussion. Secondly, I would add another sentence that says, we also want to express our support for all the collaborative work done to date. So if we added those two paragraphs in, got rid of immediate, I would support that letter.
So would I.
And I would go ahead and move that with those changes, we support sending this letter.
I'm not going to second that in the moment, but I would ask that the motion maker remove the word threat and put in concern.
That'd be fine.
I think that is,
Yeah.
bring up the,
Tone it down, but make sure our concern is recognized. Sure.
The only, and the one I have,
I haven't seconded it yet, just wanted to.
second for discussion so we can,
Is that what you're doing?
I'll second it for discussion and just. Supervisor Fennell?
Yeah, please
I-
go ahead.
And the other thing is I don't know if it is, and I don't know who validates this. Is this actually stemming from the change in ownership of the Redwoods Women's Center? I don't know where that comes from, because is it a change in the ownership? Is it a change in the difficulties that everybody is having staffing their doctors? I mean, so if the ownership hadn't changed, would everything be okay? We're making a statement in a letter that I don't know is factual or validated.
Challenges being faced by, I don't know, I mean, how much we want to wordsmith up here?
Well, and I fully agree, you know, I stayed away from it because I made the thing about somebody from the Eel River Valley is I think we all have to realize that we represent districts, but we work for the county. Supervisor Fennell, we have our,
CAO Nielsen.
May I offer a suggestion?
you do it?
I think this letter deserves some additional consideration, and I think it might be appropriate for your board to designate two folks to work with staff and come back either next week or the week after and present a letter of clarification.
I would be fine with that.
I would be fine, but I want it next week because 2 weeks, I mean, in all honesty, I mean, the body's cold and buried. It's going to be back in file 13 at the AG's office. I think we have to, don't forget, we've already sent a letter.
I will send a memo to them about that. So, to the AG's office. Yeah. So, so that would be the 4th? That's, okay. I'm happy to work with any one of you to create this letter. I'm looking for volunteers.
If we're going to, on your basis, since I Honeydew, Petrolia, Ferndale, Lolita, I have a little chunk of that Eel River Valley myself that is extremely concerned. If we're going to go off your narrative, then you and I are the ones that should probably be working with staff on it. And I'm just following your lead on this. I don't want people to think I don't care. It's why I pulled it, is why I care. It's because I've got family members that work down there and have been born there. And I was there and spoke in 2016, and I know the community cares. I also know, as you and I know, both know, the restrictions of making promises you can't keep. So I think what we have to do is be fully vetted on this and do a letter of our concern. I'm not sure exactly what they'll do with it, but I think voicing our concerns. I think more importantly is voicing our concerns as we did to to the hospital, St. Joe's and Redwood Memorial, of the concerns. I think the information will be coming a little more openly now, and I don't think it was intentional. Business as usual sometimes creates a vacuum for some people.
Supervisor Wilson?
And I'm okay with that, that setup. I just want to make sure that anything that goes out doesn't just talk about a concern, it talks about our aspiration, I guess, in terms of, you know, the collaboration that we, and again, it's obviously we've talked about this letter not being just targeted to the AG, but it's a reflection of us, and so to others as well. So I want to make sure that it reflects the work that's been done and the appreciation of the things that have gotten us to where, well, that we've even have what we have today. So I appreciate that, and so the motion maker might want to either amend their motion or repeal
I withdraw
it.
the motion.
Withdraw the motion. So I'll make a motion that a revised letter, an updated version of this be submitted to the AG's office, or not, to bring back to our board
Next week.
For the next week, with Supervisor Bohn and Fennell giving us a new update on that.
Second.
With a comment.
Supervisor Bass, did you
Yep.
want anything else besides second?
No, I'll hand it back over to the next person in line.
Okay, great. Supervisor Bohn?
Does that go with, I heard mention of a memo saying, don't read the letter we sent first, basically going, I mean, is
Yeah,
that with the,
Oh,
I
yeah.
know, but I want to be fully understood that there's a memo going out, that there's a revised letter that will be better reflect our feelings as a board.
If that's what you want to do, then yes, that will, please, that can be reflected in my motion.
Supervisor Bass?
Thank you, Madam Chair. And this, I'm fine with all this. I think it's just a really good reminder, especially when we ratify letters, because we do that occasionally, and things that will seem like they just go right through sometimes don't. But especially when we're dealing with someone in the organization where it could be reaching out and doing the talk beforehand. I think this is kind of just a good reminder that sometimes we lose track of that because we're trying to get our work done.
Well,
Yeah, and if it's not on the ledge platform. Yeah. Well, healthcare.
I'm hearing from County Council. Can you,
Sure. So my understanding is you're designating Supervisor Bohn and Supervisor Fennell to work on an amended letter with staff and bring it back to the Board of Supervisors on February 4th.
Yes, and that the chair will send clarification to the Attorney General's office on that. Thank you. Supervisor Madrone?
I think that's great. You know, it's nice to work this out, and I certainly can understand your strong concern that led you to taking this step. I have almost made this misstep, or whatever you want to call it, myself, and I came to realize, I guess, that if I just want to send a letter on letterhead as myself, as a board member supporting something in my district, I have every right to do that. But when it's an action of the board, I think that's where we're at here. So I can appreciate the situation. I've been almost there myself. But it was a good learning experience, I guess, for us all here. And I think what this also brings up is, you know, as Connie was mentioning and others have said, there have been these meetings happening at the table, but we're not there. And I would say that it'd be nice if we'd be invited to those meetings, to be at the table as those discussions are happening, because we do represent the county. And it could be the St. Joe's Advocacy Committee, which Rex is the Supervisor, Bohn is the member, I'm the alternate, but I would very much be willing to volunteer to be involved and engaged to try and help our community and our providers work through these difficult times, so.
And I will just say that for as long as I'm chair, we're not going to do any ratifying of any letters. We're just going to make you guys look at all of them, and yeah, I mean, I know we've done it in the past, quite a few times. We will not do it while I'm chair.
All right.
Supervisor Bohn. So if anybody's got a concern, they would be well advised to get their concerns to me sooner than later.
And I don't know if Dennis is still here, but I appreciate him coming in and taking the time off of his diary to do that. And I also got a call from Becky Giacomini and a couple other board members that said that they were, I don't know if everybody realizes how hard they're working to create all services and expand services. So, I mean, I expect as a board member they would say that, but and knowing them personally, I think they're very, very passionate about healthcare in Eel River Valley. And St. Joe's is committed to healthcare throughout the county, because they work with all the other, they're not competing businesses, they all have to work hand in hand. So in a roundabout way, I do appreciate them. I'm old, I'm glad you're here.
So, any further discussion? No, I'm not, okay, we're not gonna have any further discussion. There's a motion on the floor. All those in favor, please indicate by saying aye.
Aye.
Opposed? None. Passes unanimously. Thank you, everybody. Especially thank you to you guys for stepping up and hearing that. Glad to hear you're very interested in teamwork. That's great. Let's see. So now we go to public comment on items not. Oh, we have a time session. Oh my goodness, we are. We're already past our time certain. We have a time certain at 10 a.m. So we will. That is a closed session. So I'll go to County Council to let us know where we're going.
So thank you, Madam Chair. Pursuant to Government Code Section 54957.6, it's the intention of the board to meet in closed session for a conference with labor negotiators. Labor negotiators Jack Hughes and Kelly Barnes, employee organizations, both represented and unrepresented, consist of AFSCME Local 1684, Humboldt County Attorneys Association, Humboldt County Deputy Sheriff's Organization, elected and appointed officials, as well as management and confidential.
Thank you. Any comment on our closed session item?
Ken Sawatsky, this is the big closed session item. I mean, you have a majority of your employees in here. I highly recommend that your negotiations leave you some leeway should we have a major economic downturn. I've been preaching that one for a long time. I also have a suggestion, just to make a little clarification. Having inside knowledge of how long these doctors stay here, it's on an average of 2.5 years, and having spoken with the people out here 4 years at the most that young doctors stay in Humboldt County. That's track record, which I totally have full knowledge of regarding pediatrics and Open Door and Ed Humphrey's thing.
Oops, we're totally on mission drift this morning. I'm going to pull you back in. I'm sorry.
I do understand this, but I'm giving you some reasons here what you need to negotiate with these people. And so to keep them here and to go past what we're finding happen there and to recruit more people, you're not going to find wages are necessarily what's going to be doing this. I highly suggest negotiations with your sheriffs who have a hard time funding, that you have housing for the young people to stay in the communities where they're at. Let's say Garberville, you provide contracts that include those things where you have resident deputies in those areas that everybody says that's what we need out there. So the certain carrots that you offer during this contract negotiation should be to facilitate these people coming here, staying, especially the younger people who can live in a housing situation and be resident deputies. This is something that needs to happen with a lot of your employees. If you want to get a top quality employee here, same as with the doctors, you say, we have housing here when you come here, and this is part of your benefit. We have very inexpensive housing. Your negotiations with these people should possibly be considering housing packages. And this is the future of what you're going to find as far as workers, not just nationally but internationally, is these certain carrots, not just necessarily money. They need a quality of life here to come and stay here. And so I think you need to change the process as far as what you're doing with these people. Also, we have PERS that keeps going through the roof. It's going to continue to go through the roof as prophesized by your staff, not even accounting the fact of an economic downturn. There's no funding for those particular things. Your negotiations are going to have to continue to transfer those particular things over to your employees as they've already done before. But those trends have to happen because there's no way other than county going bankrupt during the downturn, and these people will not benefit. These people are the ones who are going to go down to 10 to 20% at the most as far as taking a hit on their retirements. And so please look after those people and get as many outside workers that are contract workers. We don't have to pay PERS and have the PARs and all those things on. Thank you for my opportunity to speak today. I think I was pretty well on point.
Thank you. Welcome.
Hello. I'm going to ask for a point of clarification. I'm just going to utilize my time. You have a time certain set for noon. Our names are on public comment. I personally feel our time was taken away from us by not holding people with the previous pulled consent item from our ability to speak. So I don't know if you can respond or county council can say. I see there's 2 time certain events there, 10 and 12. As far as the
Thomas, if I may, the other time certain is at 2 p.m. So I'm hoping find out from council how long we might be in this closed session. We would then come back for item number H3. H2 has been pulled, but the first thing we would do would be to go directly to public comment on items not on the agenda. So any idea how long we'll be in there?
Madam Chair, I think you should allow probably a full hour.
Okay.
Hopefully it will take less time, but I couldn't be certain of that.
Okay. Thank you. Just the other thing, I was out in the hallway earlier. The speaker out there is broken in the hallway or wasn't on earlier when I used the restroom when you guys were doing the proclamation. So anyone outside there, just heads up, it might not have been turned on. But as far as your agenda item in front of you, thank you for the clarification of the time. I support you negotiating competitive wages. I know it's hard sometimes in Humboldt County, but let's also not forget when you're negotiating, there, in my personal opinion, there is a lot of employees that kind of, I use the term suck the clock. I mean, I've heard lots of reports of different county employees in the county vehicles hiding in pullouts, private driveways. So when you're negotiating, I support you giving up some more competitive wages, but I also support with giving up those wages, getting the county to get some language back that protects you if you have employees that are not doing their job. Protect yourself as a county, protect the taxpayers to not spend a bunch of money to let employees go that are basically just sitting there collecting a paycheck and not doing something positive for the community. I support your decisions. Thank you for the time.
Thank you. Any further public comment? So again, let me just reiterate where we are here because it might be a bit confusing. We're going into this time certain closed session now. We'll come back in about an hour. We'll take public comment. We'll go to item number H3, and at that point we'll be ready to go into closed session again at 2 p.m. So we'll come back at 1:30 to announce that. So that's kind of how the flow of the day will go. I know that there are people here to discuss the waste management, and I'm sorry that we do have to go with this closed session. Supervisor Wilson.
Yeah, just to clarify for the public, so you're going to say we're not going to come back before an hour, or I mean, we should at least, if people.
45 minutes.
Well, it could be a half an hour, but the county council has said that she estimates an hour.
Okay.
And just to clarify, we'd be coming back for H1.
For public comment, and then.
H1.
Oh, and yeah, thank you.
You're welcome.
Of course. Thanks, everybody, for your help. Yeah, I know. It's nice to see you. You look all relaxed and yeah. We did take a little longer than we thought. County Council, anything to report out of closed session?
So, Madam Chair, there is nothing to report from closed session. Thank you.
Thank you, Council Angus. So that will bring us to comments from the public on items that are not on the agenda. Do we have any comments on items not on the agenda? Oh, thank you. We have a list. Thank you, Kent. So we'll start with Vernon Price. Welcome.
welcome. Thank you, Madam Chair, ladies and gentlemen of the board, Madam CAO, County Council, ladies and gentlemen of Humboldt County. Soon to be this afternoon, you have before you a letter that I have signed. I have given an email prior to this letter. This is very nervous for me to render this, but this is a very serious matter. A formal grievance concerning Health and Human Services Director Connie Beck. Dear Humboldt County Board of Supervisors, I come to you today with a heavy heart and a broken spirit. On February 27th, 2019, I had the honor and privilege to have a meeting with our Director of Health and Human Services, Connie Beck, which was scheduled by Director Beck's executive assistants at 4:15 p.m. to 4:45 p.m. in the small mezzanine, if I'm pronouncing that correctly, conference room located at 507 F Street and known as the Pro Building. The purpose and intent of this meeting was to discuss a grievance previously submitted to the Humboldt County Mental Health. I, as well as the patient's rights advocate, Melody Belts, and the Department of Health and Human Services Compliance and Privacy Officer, Amy Cohn, arrived slightly prior to the scheduled start time. However, Director Beck did not arrive until 4:30 p.m. At the conclusion of the meeting, Director Beck said, quote, unquote, directly to me, or quote, I asked, can I ask you a question? I responded affirmatively. She went on, Mr. Price, have you taken your medications, unquote. I find this extremely disturbing and emotionally traumatizing. As a consumer of mental health services in Humboldt County, I am trying to overcome the stigma associated with mental illness and manage my symptoms so that I am in control of my mental illnesses and that the mental illnesses is not in control of me. How can the battle against mental health stigma be fought when the leadership of Humboldt County of Health and Human Services demonstrates it during business meetings? I bring this information to you today because this unethical behavior does not fit the standards of public leadership, and the memory of its moment has disturbed me in the past 11 months. I don't have enough time to finish this. This is time, or my name and address and contact information is listed. This was filed with the civil grand jury at 8:45 a.m. this date. I am in hopes that someone from I thank Supervisor Rex Bohn for giving me an email on a weekend on your time off in regards to that. Thank you for your time.
Thank you, Vernon. We all have the letter here. Thomas Mulder.
Well, still good morning. It'll be afternoon by the time the end of my comments. Thomas Mulder, CEO, Humboldt Redwood Healing. I'm coming before you a couple of things. Just to make you aware, for those of you that don't know, it's a 2.5-hour trek round trip for me to come up here and speak to you. So I hope that you realize I really care, and that's why I'm here to talk. I'm going to come before you again. Spring's coming up. I've asked before, amend Ordinance 2.0. Let's figure out something. I talked to a lot of people, and there's a lot of people that the 6 plants goes past the 200 square feet we allow on an acre. That's what they need for their personal use, medical needs, whatever that may be. So a couple weeks back, I had an idea. I'm going to say it again. Use Measure S tax dollars to buy some sort of devices that can work with our satellites. Let's increase on over an acre, allowable up to 500 square feet of personal use, as long as they come in with a doctor's note to get those 4 little beacons, up to 200 square feet on parcels less than an acre. I live in a residential area. If my neighbor had 200 square feet right next to me, it wouldn't affect me, it wouldn't bother me. So that's it for amending 2.0. I just really think that we should look towards those people that are left out. 500 square feet isn't enough to join the regulated game, plus their own personal needs. Let's do something. Another thing I want to bring to your attention, it's come to my attention that some commercial activities within Humboldt County are not held to the same standards, especially when it comes to roads, as cannabis activities. I've brought some of that information forward and provided it to the right people, and I hopefully I'll get a response. But I want to remind you, if you're going to hold us cannabis businesses, commercial activities to a high standard, that every other commercial activity on the same sort of road is held to the same standard as a cannabis commercial activity. I want parity. That's all I'm asking for. Really, really strong rules, middle ground. I wouldn't go lenient because the environment's compromised, but some sort of parity between everyone else. And then lastly, over social media, I saw something that was posted from Mountain Exchange. I recommend you look it up. Of a portion of Island Mountain Road that's county maintained. It's really disturbing how much sediment and discharge is coming off that road. I recommend you look it up if you do social media, Mountain Exchange. But if that was my road, I wouldn't be able to be here because I would probably be in jail right now. Just take that into consideration. This is county maintained roads that are discharging sediment into sensitive waterways. Thank you for the time to speak.
Thank you. And Maggie Gaynor. Pardon? Okay, great. You didn't want to speak on items not on the agenda. Thanks, Maggie. Okay. No more people signed up?
Ken Sawatsky, I had a very interesting morning. I have three mothers. My number one mother is Mother Nature. My number two was the one who adopted me. And so I spoke with my mother, who I hadn't spoke to in 66 years. Last time, I believe it was either in the delivery room or the womb. So that was an interesting experience for me this morning. Kind of gives you a little perception on life, and you learn a lot from these kind of conversations. I did wish to bring forward something here. We have a letter to the editor, and down below it here, there's a little re-elect Estelle. I'm not going to talk about that one, but it does say Humboldt County honored for budget presentation. And it goes on, and it's from a Graham Knaus, I think, Knaus, K-N-A-U-S, Executive Director, California State Association of Counties. And I've attended most of those meetings, some of them 2 different ones during the year in different forms. One of the original ones I attended was, I think it was down in Rex's territory. He had cookies and he had a prize, and Billy Hansel got the prize. So I think it was one of the very first ones I attended down there. So I've had my share of going to those meetings and seeing what happened. Frequently, I was one of the very few people who went to them or spoke. It's great to see a lot more people there now, and that's a great thing to see. So compliments on that. I do have a problem, though. It says we have honored Humboldt County twice in the past 5 years for its innovative budget process that focuses on transparency and community input. Well, a lot of us feel that, who started speaking a long time ago about alternatives to housing first, felt like we were ignored for probably 4 or 5 years here. And the policy kept going. We wanted tiny villages. We wanted to see some of those other alternatives. So I'm really glad to see finally you guys are looking at that with some push from the dais up here to look at those things. That's public. When you make a lot of time to make input and nothing happens, you get kind of just. And the other comment I wish to make is on transparency. I was very disconcerted the other day to hear that down in Soham at one of the meetings down there, an individual was precluded from taping the meeting, from filming the meeting. And allegedly, I'm going to have more information on that. I'm not going to go into detail, but that did happen. That's the opposite of transparency. Maybe I don't understand, but I thought it was our right to come to meetings and to do that. And if that's been violated in this process, then that's very disconcerting. And I will do a little more information on that before I be any more accusatory. I like to have my ducks in a row. And lastly, I just wanted to say that, we're going to have a really hard time getting anybody to come here to work on these jobs. And it's going to take all of us. We discussed that a little bit earlier today, because we still have the stigma of being a murder mountain kind of place. And I know more good people are moving out of here than are coming in my opinion, including some of my partners and business partners. And I am looking at my options also. I will always probably have some family here, but there's problems here in Humboldt County.
Thank you. Any more public comment on items not on the agenda? Seeing none, I'll bring it back to the board, and we'll go to our first item, which is consider making appointments to the Law Library Board.
Hi, good morning.
And welcome, Tracy.
Hi, I'm Tracy D'Amico with the Clerk of the Board's office. This morning before you, afternoon before you,
is the appointment to the Law Library. On January 7th, the board was notified that there are 3 vacancies on the Humboldt County Law Library Board of Trustees. These are annual appointments. One seat is an ex officio member, which is typically the chair, but the board may appoint a member to represent them. And 2 are at-large members that need to be in good standing with the California State Bar. There are 4 applications on file, which were included in your agenda item, and it's the pleasure of the board to fill those appointments today.
Thank you. I'll bring it back to the board. Supervisor Bohn?
And I've been serving on the law library for the last few months and everything else, and it's kind of interesting, to tell you the truth. But I asked for clarification. I think I got it. We don't necessarily, we can appoint somebody. We don't necessarily have to have an ex officio from the board on it. Is that correct?
Correct. Your board can appoint a board member or another member of the public to serve in the ex officio capacity.
Okay. So I'd like to make a motion. And I'd like to make a motion that we put Cindy Day Wilson, Dustin Owens, and Merrick Rivas as our appointees to the law library. With that, Cindy Day and Dustin are already serving and do a great job. And Merrick, being our public defender who's done a great job with that, I think would be a great addition. So.
But I have a question. Don't we get to put through?
We have 4.
I said
but there's
3.
Okay, you said 3. Yeah, because actually you missed the one that wait, who's your third one? Just
Merrick, Dustin, and Cindy Day Wilson.
Because my choice
there was a Lorius.
I'll second it for conversation.
Okay.
Yeah, because I think my choices were going to be Dustin Owens, Merrick, and Stephen Lorius. But I don't know what others are thinking.
Okay, so you're seconding the motion without specific?
I'm open for the conversation. I just,
Yeah, okay.
I just have been doing, just some of my own research and I think of potential effectiveness, but, it's the will of the board, so.
Okay. Supervisor Madrone?
Thank you, Madam Chair. I just wanted to ask you, as chair, were you interested, or is there any other board member that is interested?
In this particular, no, I'm not.
You're fine.
Does Rex want to stay on?
Okay.
I wouldn't mind staying on, but the 3 that I chose, two of the 3 I've already served with, and in all honesty, I firmly believe Merrick brings more to the party than I do, because being a public defender and a member of the bar, which is the ex officio, does not have to be that position, but we have. That is a great place for people that aren't necessarily in a law firm to get their research. It gets enough visits to warrant what goes on there, and the meetings are attended by 6-8 people, which is sometimes more than ours and sometimes less. But so I thought Merrick could cover the one in. Maggie serves on it. Maggie is on there. No, excuse me, is she going?
No, Maggie did not reapply.
Okay, that's okay. Maggie has been on it, so I just figured that way somebody in our judicial system that from our side is on there.
The names that are on the staff report are Cindy Day Wilson, Dustin Owens, Merrick Rivas, and Stephen Lorius.
Yes.
So I had one more follow-up question, and that is Merrick, would he be an ex officio as a public defender?
Sure, any of the 3 can be your ex officio.
Okay, they don't have to be a public official.
They do not.
Okay.
In the code, in Business and Professions Code, they can be a member of the public, the ex officio.
Okay, great. Understood, yeah.
Okay.
Still learning.
Any further comment? Supervisor Wilson?
What I don't see in the staff report, and I apologize that I didn't follow up with this, was the makeup of the board in its entirety. And so could we just review that in the current board, like the number of members? And then also, my question is, is there anyone on that board that's not a practicing attorney, that is just a member, that would represent just the member of the public?
think that would be Lawrence.
So there are 7 appointments, four of which come from the Superior Courts, and I believe Supervisor Bohn can speak to who those 4 appointments are.
It's the judges, basically, and the one who's been attending the meetings is, Monday's meeting, there were 3 judges at it. So, and as, it's not a member, and not to downplay this, they're serving the members of the public, and all these people are members of the public. They just happen to have law degrees. So I see what you're saying, but I don't know if it's, I don't know. I see what you're saying to be all encompassing, but
I haven't said it yet, but, so what I'm getting at, yeah, exactly I think you might understand what I'm saying, which is that if everyone is practicing attorneys, but this is supposed to be, it's a public law library. And so the perspective of someone who is not necessarily a practicing attorney, but that may want to access this facility, may have a different opinion, may have a different perspective than practicing attorneys and judges. And so I'm just saying, it seems like we might want to consider sort of the diversity of voices that that talk about the access and to that resource. In which case, we only have one person here that is not a practicing attorney, and that's Stephen Laureus. So I think it's something to consider in the perspective of voices that we have for this, what's supposed to be a public resource.
I fully agree, and I think somebody from the public that was going to be using it, that's why I thought Merrick would fill the bill, because you'll find a lot of people that are going through the public defenders, they will try to do a little bit of their research to help their own case sometimes. And so if they're in a court appointed, they're going to be dealing with somebody that's on there. And so I'm open to anything, but.
Okay, so, so far I've heard what it sounds like 2 of you support Stephen Laureus, Mark Rivas, and Dustin Owens, and 1 of you support Mark Rivas, Dustin Owens, and Cindy Day Olson. So can you hash that out a little bit more? I haven't heard anything.
I do, may I ask you a
Yeah,
question?
please do.
Unless I'm reading this wrong, it does look like Stephen Laureus was recommended by the law library staff. So I suspect that there must have been some vetting regards the more public person part. And Supervisor Bohn, you might actually be on that letter. I know your name was on. Are they all on there? Just the staff, yeah, okay. So I just knew his name. I knew there had been some recommendation from staff, so wasn't sure how that, not our staff, but the law library staff.
There were actually 3 letters that were submitted as support. One was from the board, and that was to keep Cindy Day Wilson because she was currently serving as the chair. And the other 2 were from the law library staff for their recommendations. I do know that the letters of support came after the agenda item was posting the vacancy. They're a very active board, and they would just like to get it filled sooner than later.
And I would figure that they would have wrote one for Merrick too if he would have asked him.
Oh, exactly.
Because it looks like everybody's got a letter of support except Merrick and short of, and Merrick's is the one I would probably be preeminent to be on there because of the defense and what he's doing. He's providing law services to people that can't normally afford it, who may want to do some of their own follow-up, so.
I completely agree with that was an assessment.
Supervisor Madrone?
Yeah, I would support Dustin, Stephen, and Cindy Day.
Oh, wow. We may have to do one of those. Supervisor Wilson?
Secret ballot.
Again, nothing precludes anyone from the public to show up to these meetings, correct?
Public meetings
These are public meetings, so in many ways, I mean, if someone is interested or can provide their expertise, and that includes Merrick or anybody else, then they can do that. So I just want to, point that out.
I can pull mine back, or we can vote on it, do whatever you want. It does, the meetings take about 25 minutes. Every item, they allow the public to speak. They actually respond to when the public speaks. There's usually only one person that talks. And I can see by the crowd here that it's a hot button item, so it doesn't really matter. I just thought Merrick covered a lot more. I don't know Stephen Lorius. I know that he serves on a lot of stuff, so it looks like. And he's fairly new to the county, I believe, isn't he?
Yeah, I have served on, let's see, the Behavioral Health Board with Stephen, and he's been a good member of that board, provides good input. And so I think I support Supervisor Madrone's list of appointees, and we would encourage Merrick to check in with the law library as part of his job to be able to keep that resource available for his client base. I think that'd be important.
I will withdraw my nomination, or withdraw my motion if you want. I mean, I'll wait till Supervisor Bass speaks.
Supervisor Bass?
Yeah, see, and I'm going, I really think Merrick has a place there. And I chose, Merrick, Dustin Owens, and Stephen Loria. So we have different ways we're approaching it. I'm not going to dig my heels in and have it be the hill to die on or anything. Those are just the people that I felt comfortable with, bringing forward as names. But
does anyone have a coin?
No, it's not that. I don't think Merrick's going to get upset by not getting it, because I know we all got numerous phone calls from him going, I need to be there, not.
Okay.
So in turn,
think
I
he's
will
really
withdraw.
Okay.
I will withdraw mine, and you guys decide who gets to go once a month for 25 minutes, so.
Yeah, and before, maybe it might be helpful, is there anyone in the audience who would like to address this issue? Is there any public input?
Well, Merrick's not here.
So we're, public comment, please. Thank you.
Good morning.
Good morning.
Your Honorable Board of Supervisors. My name is Stephen Lorius, infamous. I am a native Floridian. I'm matriculated through a bachelor's degree in psychology and a master's degree in education. I began my professional career as a communications department trainer for Hilton Resorts, and later became a director of applied behavior analysis at a Center for Autism and Dyslexia. I serve our community in part as a licensed behavior analyst. I provide pediatric through adolescent behavior intervention and advocacy for families that are experiencing the symptoms of mental disorders and developmental disabilities. In 2018, I was appointed vice chairman of the Humboldt County Behavioral Health Board, and in 2019, appointed human rights commissioner. As a neutral, I also maintain that the definition of the word public as used in the law library's mission statement is and should be inclusive of and therefore represented by multiple professions. So I desire this behaviorist's perspective to join, enrich, and diversify the law library's Board of Trustees. Thank you for your time and consideration.
Thank you, Stephen.
Can I make a new motion?
Yeah, absolutely. I think
the only reason I made a
Stephen
motion
did
earlier
really
because
well.
I thought this was going to be fairly benign. So, so let's Cindy Day Wilson, Dustin, and Stephen Lorius.
Can I just clarify?
Anybody?
Can you please, so the ex officio does not have to be a registered attorney, so.
So
can
the
you
ex
revise
officio
your-
would have to be that. There's,
Can
and
you-
the only way he would qualify to be our ex officio, so he can have another title.
Thank you.
I second
So, well, so the motion would be corrected to Stephen Lorius would be ex officio, and Dustin Owens and Cindy Day Wilson would be the other members, the at large. Okay. Got that? Anything? Yeah. And Supervisor, great. Any further discussion?
I hope not.
Seeing none, all those in favor, please indicate by saying aye.
Aye.
Opposed? None, passed unanimously. Thank you very much for being here, Stephen. So that brings us to our next item, which is H3. And are you guys hale and hearty and able to go through this? I think you are. You all look like you're going to stay.
She's relaxed.
So, thank you very much, everybody, for sticking around. I know our meeting went a little longer than we anticipated, but I'm really glad that you're here. And this comes to us from the Public Health Department. Welcome, staff and former staff, or I'm not sure what you're doing there, to give us that a presentation on an agreement between Humboldt Waste Management Authority and the County of Humboldt for continued implementation of county waste reduction programs through June 30th, 2022.
Yeah. Good morning. Good morning, Madam Chair and members of the board. My name is Carolyn Hawkins. I'm with the Department of Health and Human Services Division of Environmental Health. I'm working part-time as, yes, I retired 2 years ago, but I'm back helping to fill in temporarily. Part-time as the Senior Environmental Health Specialist in the Solid Waste LEA program. I'll be referring to this program as the LEA throughout the rest of the presentation. With me is my supervisor, Mario Carlson, and Director of the Department of Public Works, Tom Matson. And I will give a brief history of the item before you, which I will not say the title because Chair Fennell just did. Following that, I will give some highlights of legislation that will show that the scope of waste management has changed drastically and requires significant action by the county. If possible, if you can hold your questions until the end, some answers may become apparent as we proceed. So 31 years ago, California's and the nation's first major solid waste legislation was passed with Assembly Bill 939. This created the Integrated Waste Management Act. It did many things, and among them, it required local governments to appoint solid waste task forces to engage in planning waste reduction strategies. It mandated a 25% reduction in waste generation by 1995 and a 50% reduction by 2000. It established a reporting requirement and created that created the local solid waste facility permitting, inspection, and enforcement program, which is the LEA. In response to that act, and to significant public interest within our community, the Division of Environmental Health created a waste prevention coordinator position in about 1990. A significant portion of the work completed by this person in this position was actually done on behalf of Public Works, as it involved the generation and reporting of data on the amount of waste generated. And Public Works has specific access and generation of that data. Your board approved the transfer of the waste reduction program to the Humboldt Waste Management Authority in 2006. And this generated the first agreement between the County of Humboldt and Humboldt Waste Management Authority for AB 939 related services. In general, those would be education, gathering and reporting of data to the state, some litter reduction services, things like that. Although the contract has been negotiated and brought to your board ever since by DEH staff, we recognize this work as largely unrelated to our state mandated role as the local regulator of solid waste facilities. So that's the history. And here's a look at today and beyond. So climate change is now driving a diverse range of waste prevention and reduction efforts. They place mandates on local governments, and they are many and they are substantial. They're not within the scope of the LEA. Our duties are limited to permitting, inspection, and enforcement at solid waste handling sites. They're not within the scope of the agreement before you, which reflects the mandates established in 1989. Our two departments, Public Works and the Department of Health and Human Services, are in agreement that they are best managed by the Public Works Department. And so that's why staff recommendations 2 and 3 appear on the item before you. They are meant to clarify the roles of the LEA and Public Works with respect to the agreement and to future waste reduction agreements and activities. I'll speak to a few aspects of bills that have been passed since 9/39, and they will underscore Public Works' request for a newly created position that will be dedicated to working toward compliance. On this slide, only items 1 and 2 are relevant to our discussion, so you can please disregard items 3 and 4. AB 341 set a state goal of 75% diversion of solid waste stream by 2020. It required mandatory recycling by businesses. This required local governments to ensure that commercial recycling programs were available. And these are just snapshots of some of these major legislations. 1826 relates to the diversion of organic wastes, which are food waste, yard trimmings, wood, and paper waste. This legislation requires commercial businesses to arrange for recycling of the organic waste that they produce. Local jurisdictions are required to adopt an organic waste recycling program in the form of capacity assessment and education. This bill authorizes local governments to charge and collect a fee from generators to recover the costs of implementation. They don't all specify that. Assembly Bill 876 requires a county or a regional agency to include in its annual report to the state an estimate on organics generation and the capacity needed to process it over a 15-year period. Senate Bill 1383 is wide-ranging, and it is the big one. The first 2 points are related to state entities, so only items 3 and 4 are applicable to our discussion. But the important things here are that this bill sets organics disposal reduction targets, and it gives CalRecycle the regulatory authority to achieve the solid waste aspects of this legislation. So the remaining slides cover only Senate Bill 1383, and they've been downloaded from CalRecycle's website. This is the most significant waste reduction mandate to be adopted in California in the last 30 years. In general, it requires the state, not local jurisdictions, but the state to reduce overall its organic waste disposal by 75% by 2025. And it requires the state to increase edible food recovery by 20% by 2025. Landfilling organic waste leads to its anaerobic breakdown, which creates methane. Landfills are the third largest producer of methane and responsible for 21% of the state's methane emissions. I will note that the vast majority of Humboldt County's solid waste that is destined for landfilling is transported to the Dry Creek landfill outside of Medford, Oregon. There, methane is collected, it's converted to electricity, and it provides a large segment of the energy needs of Medford and the surrounding communities. This does not get us off the hook. There's a lot of information in this slide, but I will point out just a few key points are that the regulations are not quite adopted yet. The current target appears to be late February. The regulations then take effect and state enforcement begins in 2022. Local governments will be required to take enforcement action against non-compliant entities, businesses, and residents in 2024. So in order to be able to meet the 2022 deadline, CalRecycle expects that local jurisdictions will be planning and making programmatic and budgetary decisions regarding the requirements in advance. In 2024, jurisdictions will have to take enforcement, as I mentioned earlier. In general, the jurisdiction responsibilities are to provide organic waste collection services to all residents and businesses, to establish edible food recovery programs for all commercial edible food generators, to conduct education and outreach to all generators, to abide by redefined procurement parameters, to provide to monitor compliance and conduct enforcement. The county, in fact, all local jurisdictions, this is not applicable to just the county, will need to adopt an ordinance, or a number of them, or similarly enforceable mechanisms that are consistent with these requirements prior to 2022. So by January 1st, 2022, I just mentioned that the enforcement mechanism needs to be in place. For the following 2 years thereafter, the local jurisdictions will need to identify businesses in violation and provide educational materials to them. The goal is to make sure that every generator has the opportunity to comply before mandatory enforcement starts in 2024. As part of the mandatory enforcement that local jurisdictions must apply, mandatory penalties are prescribed. So under SB 1383 regulations, if CalRecycle determines that a jurisdiction is violating one or more of the requirements, there are timelines for corrections, some opportunity for corrective action plans to be utilized. And then finally, monetary penalties will be part of the scheme. So you may notice that the state can authorize waivers for rural areas and those with low populations. Previous legislative packages provided for this too, and Humboldt County hasn't yet met the criteria for a waiver. So Director Batson indicates that this is still the case. So that's a lot of information, but for more information and to get on a listserv, here's a couple of web addresses. And we will do our best to answer any questions, but please understand that the reason Public Works has requested a dedicated position is because the county currently does not have staff in place to follow up on legislation to dig deep into this. This presentation is meant to bring this issue to your board's attention and to the public's attention for needed action. We are just opening the door with this. In addition to hiring staff, there are local groups and individuals with knowledge and experience and interest who can assist us in moving through this. The Solid Waste Task Force, which I mentioned earlier in the program, has been re-energized in the last few years, partially by these mandates. They meet quarterly in a public setting, and they have the potential to be a great resource and a vehicle for helping each other, all the jurisdictions, reduce their waste footprint. In addition, the executive director of HWMA, Jill Duffy, is in attendance today, as well as staff of Zero Waste Humboldt, and they may also be resources for information and answers to questions.
Thank you very much, Supervisor Bohn.
I appreciate that. I know the organic waste diversion is, we've been trying to get the population levels changed just because our population levels in our 4,400 square miles that's going to be a tough nut that we've been trying. I think I'm the longest serving board member on HWMA at 7.5 years. So with that being said, you mentioned it 2 times or 3 times that we're going to be hiring staff. Would this be better something contracted out to Zero Waste and HWMA, since their fingers are already buried in it, rather than burdening the Department of Environmental Health and Public Works with more staff?
No, because we have a significant amount of solid waste oversight as it is, and unfortunately it's being performed by either myself or Charlotte, my deputy, at a very high salary rate. With the expanded duties coming on, note that we do already have a funding stream for the position. We will not have to be asking the board for any funding for the position. What we're simply looking at, we have a significant amount of work already.
Tom, explain the pot of gold you just brought up that we have a fund, because it almost sounds like an unfunded mandate to a certain extent.
Well, technically, it is an unfunded mandate. We have a significant revenue stream from both our franchise fees and through the solid waste tipping fee for the Table Bluff landfill to cover the work that we have to do out there. We've been holding back on doing anything really with the franchise fees because we're rebuilding the Redway transfer station. But at this point, we have sufficient funding collected, and there is sufficient annual revenue to cover the staff position that we will be requesting.
And I fully agree with that. But what I'm saying is, and I think we sometimes get a little bit adrift. Just because we have the money doesn't mean we need to hire someone. I mean, if we could have, we have an organization, Zero Waste, who's all over this, trained and all over this. I don't know if they'd even want to do it. And then we have HWMA, who we contract with and have been together with years, who are actually at the site and all over it. So I agree that if it could take some burden off of you by using them, I'm just saying, if and when we get this under control, and when we get it under control, then we'll have a position that, hopefully we're using, everything, and by 2030 and Zero Waste comes close to being damn near zero waste, and the position won't be needed. So but then you've got an employee that's 10 years in or 9 years in, and so I'm just saying, if it's not if it's impossible to do, I'm just saying, is that an avenue we can look at?
We do already work extremely close with HWMA. But we pulled back on many of our contracts years ago. They were managing our franchises, and we pulled all that back internally. I do simply believe there is a sufficient amount of solid waste work that is going to be needed by our jurisdiction, whether we contract with Zero Waste or not. We haven't even had the staff to be able to really outreach to them, and they have some very good things going on that we need to incorporate into our programs. So we can't disavow everything that we need to do, and we need to have a person coordinating it.
Any other questions or comments? Supervisor Wilson?
We have a representative from Zero Waste here. Do you want to speak to that question from Supervisor Bohn? No? Ask for it now.
I'm Maggie Gaynor from Zero Waste Humboldt.
many of the points I was going to make have been summarized right here. Zero waste and sustainable materials management. It's moving things in a new direction. In public education has got to be handled differently to change behavior, not just kind of, sloganeering and that kind of thing. We would love to contract with the county to help it with this new transition to a new direction, a new way of thinking. Much of it's driven by the state and even the county's own development of a climate action plan. But it's less and less on just landfills and waste management, and it's more and more sustainable materials management and addressing the more significant role of waste in climate change than had been previously considered. So one of the things that comes to mind is I've been working in this field since the mid-'70s, and I've watched these transitions. Some of the legislation now, we look back, and the overemphasis on recycling instead of waste prevention has resulted in a lot of unintended consequences. So that's what's being corrected now, and there will be more and more legislation coming in this new direction. It's not same old, same old. So one of the things that comes to mind for me, as I've observed over the years, rural counties that I've worked with that have expertise in a staff person, a knowledgeable person, who is in communication with their colleagues in other rural counties and around the state in the field of zero waste or organics or whatever the particular area of waste is. They're in a better position to work with the state and appeal to the state for funding. As each new piece of legislation comes along, the state usually sets up a grant program to help the local organizations implement. And if you don't have that point person that is knowledgeable and works well with others, it becomes, we've had missed opportunities in recent years with Humboldt County. And
Maggie, hold on one second. So I'm going to take that as a yes. We
would like to work with the county, but
Yeah.
I want to say I agree that there needs to be a point person in county staff.
Now, that's why I was asking whether
Yes
you
and yes.
whether you support this position within the county that supports you. That's all I wanted to really find out. And then we'll get to public comment too. Thanks.
Thank you. Any further discussion from the board before I go to public comment? Supervisor Madrone.
Yeah, the whole idea of organic waste management, I think, is fantastic. As a composter, I produce 100 bags of soil a year out of my compost system. And at $12 a bag, that's $1,200 worth of soil that goes into my organic garden. So I know it works, and it feeds my worms. My kids are always making fun of me, when I'm out mowing the lawns or raking. I say, I'm just collecting worm food here, So, but I know that, if you put organic waste in your garbage, that creates a health hazard as well as an animal attractant. And so there are lots of associated costs with us not separating our organic waste. Bears get killed, and raccoons and other animals become dependent on the blue can. In my area, the blue cans are for garbage, which is also very bizarre. There's no consistency in the can coloration. Used to be blue was recycling, right? And brown was waste, but not in the North County. So I'm really supportive of that. And I'm curious if you all have investigated other counties who have developed a organic waste recycling program, because I know it's complicated. You can't just put it in a bin and somehow how does the truck gather that, et cetera. I'm thinking neighborhood systems and other kinds of things that could work really well. People may not want to produce compost, but others might. You've got community gardens. You could have community composting systems and stuff. So I'm just really curious about the research that's been done into that. I'm sure people have figured this out somewhere. And then in addition, the idea of recovering edible foods. There's this movement now of food pantries in neighborhoods, which is a fantastic way of helping to gather up your excess garden produce and other things and put them in a pantry in the neighborhood. And these things are maintained by the individuals, by the neighborhood, no cost to the county whatsoever. So those are some of the solution pieces I'm seeing. And I guess, are we here to talk about waste management as a whole or just organic waste today?
Well, I'll try to jump on that question. We're talking about all waste, but specifically the organic waste that's coming up. And, you know, you've brought up a couple of things that already would be tasked on that staff person. Because the last thing we really want to do is set up a new collection route for organic food waste. Because I haven't run the calculations, but I'm guessing you're probably going to have more greenhouse emissions from the trucks than we're going to reduce from the food waste. And so we want to look at local small-scale solutions.
Absolutely.
We've looked at an anaerobic digester for the community. The cost of that is astronomical, and the waste board doesn't give you credits for that because you're converting it to energy. You're not converting it to a compost or another project. So that would be one of the first tasks that staff person would be looking at, is looking at what kind of community-based small-scale food things that we can do. We know there's several out there already. Can we expand them? And so that's really, we want to get a jump on this before the rules say you have to have collection. Maybe we end up with collection, but I don't think that's the best solution for Humboldt County.
Yeah, and I guess ultimately the state may have to get on board with their own climate plan and local climate plans where we're saying, well, we may not be composting it into soil, but if we're turning it into energy, that is a positive. And, you know, so, I mean, we have dairy waste, we have fish waste, we have parks with lawns and leaves, and then add up all the neighborhood collection sites perhaps to reduce the cost of doing this, whatever the solutions are to look at that. I think there's some great opportunities there in terms of our climate action and producing some sort of energy out of this with digesters, as you say. But I also get a lot of calls from people who are really embracing this whole idea of not buying plastic and all this packaging at the starting point, right? Which is where the most effective piece of our control is in our purchasing decisions. But we don't reward that behavior. I mean, yes, now it costs you 10 cents a bag at the store if you didn't bring your own cloth bag and some things like that. But, you know, taxes on packaging, I think there's a lot of discussions around that. But more importantly, people that do a really great job at making better decisions about purchasing, they only have one can a month. And senior citizens, you know, one can a month often, right? But they're taxed or they're charged for 4 cans a month, and there's no system to reward. So, I mean, if we're going to implement all these waste management things, we've got to have much stronger incentives in place for those people who only have 1 can a month. And in particular, if there's no organic waste in there. And somehow somebody's got to invent a can that like turns a certain color if there's organic waste in there. So you know this person's putting organic waste in, there's a higher charge to dump your garbage, right? Whereas if there's, you know, the can stays the right color, there's some little thing that happens that interacts, then you know they're actually recycling that waste and they have a lower cost for dumping, you know? So how do we incentivize the behaviors that we're looking for, I think is what I'm looking for. Thank you.
Thank you very much, Supervisor Madrone. I think the bottom line here for us today is to authorize the agreement between HWMA and also to authorize the new position. And I do think that as we move forward with those goals of 2022 and 2024, there are other items that we will want to discuss. So I'm assuming that's going to be coming back to us in terms of the implementation of the plan, et cetera. You know, whether there are some things we can and cannot do, such as providing organic waste gathering places throughout the whole unincorporated area. Not sure about that. So, Director
Could I
Manson.
clarify, we are actually not asking for the position today, we're just giving you information on it.
Okay.
The action within the recommendation is when we develop that position after, if it is approved by the board, that the reporting that is now done by environmental health be directed and delegated back to public works, so we don't have to come back to the board to have that happen again. But
So
we are not asking for a position today. We're just giving you information on where we are trying to go.
So that comes upon completion of the current classification study?
Correct.
Great, okay. Yeah, that will, great. Any public comment on this item?
Good morning, Jill
Welcome,
Duffy, Executive Director of Humboldt Waste Management Authority. Basically, I just want to be here for a couple of reasons. One is to support staff's recommendation. Back when I was on the board, the activities were split between the two departments, and it was always kind of a challenge. Who's on point for handling solid waste issues? Sometimes it was environmental health, sometimes it's been public works. In my capacity as the executive director, I will tell you that that has served to continue to be some real challenges in terms of consistency and the institutional memory, and having somebody within the county being able to advocate and understand how pieces of legislation is going to affect the county, not HWMA, not the city of Arcata, not the city of Blue Lake, but the county as a whole proper. With respect to the agreement, we are asking that it be effective last July. So I want to give, yeah, that's correct. It's been in the works for a while. So we continued with our working relationship with the county. And I do want to let the board members know that this agreement was approved by the HWMA board directors on October 6th. We did prepare the electronic annual report, which was submitted back in August. And we have prepared and submitted the grant that went to the beverage containers. It was actually an $18,500 for this year. So that will help to fund some of the advertising, educational, and some of the litter reduction programs. And, you know, we're continuing to, you know, handle the HHW and the e-waste and, you know, all the different services that HWMA provides. With respect to establishing a designated person, Supervisor Madrone, you brought up the need for incentivizing things. That's through your franchise agreement. And so your staff right now is overtaxed. They're sort of, you know, keeping baseline. They're being able to make sure that services are being provided, but starting to drill into some of the finer details about what those agreements can and cannot provide is really important for the county to have somebody to advocate. Same thing with respect to the organics. You can have organics collection, but currently we don't have a place that can process organics. Is this going to be a public endeavor? Is it going to be a private endeavor? Is it going to be a public-private endeavor? Those are the conversations that are so desperately needed right now, and everybody's kind of still operating in little vacuums, and we're trying. One more thing, if I might, which is HWMA is undertaking a waste audit. It begins next week, and so we'll be doing 2 samples, and we're going to be doing a wide characterization. We initially did this in 2010. There was a slight state update that we were able to kind of recalibrate some of our numbers, and we're starting it again this year, about $142,000. It's a pretty extensive endeavor, and it's really going to get at a lot of this information about organics. How much material in the waste stream could still be recovered? That is going to be crucial information for all of our member agencies to decide what kind of programs they need to put together. And with that, I'm available for any other questions you may have.
Thank you, and actually, you didn't really need to have the timer on. You're party to this whole effort here. Any further discussion at the board? Otherwise, I will entertain a motion.
I just wanted to make sure that Maggie said everything she wanted to say. I apologize for... Okay. And I want to thank you, Maggie, for all the work that you do for us in terms of this solid waste reduction. I just looked at the agreement date. Thank you for clarifying that it starts on July 1st, even though it's signed by you November 19th, but I'm sure it'll all work out. I want to also offer that everything Maggie said is absolutely spot on in terms of if we're to represent ourselves in this change that's coming, and I think it was explained very well that these changes are coming and they seem like they're years away, but they're coming real fast and they have consequences. And it's not just consequences to us, it's consequences to our constituents and to our business community. And we gotta catch up and be in front of the ball here to help them also adjust to these things. So I appreciate that. So with that, I make the motion that we approve staff recommendations for this item. And one more thing is, I would ask that that Tom take a look at the Civic Spark program for potential additional funding for staff on this as well.
We have a motion and a second. Any further discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Opposed, none. Passes unanimously. And thank you very much for your presentation. And Mario, you speak way too much.
Thank you.
So with that, we will be coming back here. We're going to take a break for lunch, and we'll be back here at 2 p.m., at which point we have time certain 3 closed session items. Thank you very much, everybody. Okay, we're back out of closed session. C.L. Nilsson, anything to report out?
There is nothing to report out on any of the 3 items.
Thank you. We are adjourned.
Yellow, this one.